Breakfast with Spaniels with Dr. Judy Morgan.
Sweater, you're right on top of things. I think we can still call it Breakfast with Spaniels if we're on before noon.
Remember, you can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com. Now it's time to sit back, relax, and enjoy the show.
Yeah, this is a great topic because I just about lost my mind this weekend on one of the Facebook pages where I am an admin. I don't have time to monitor all these pages, and I rarely look at them. But this one, it just caught my eye. First of all, somebody posted a picture of an x-ray, so I was like, oh, cool. But it was an x-ray of a constipated cat, and I'm not talking like it had a little clog. I'm talking this cat had a clog. Like most of the abdomen was filled with this humongous poop ball. And it wasn't this person's cat, it was a friend's cat, and she was asking for advice for what this person could do. Now, the really sad thing is that the person took the cat to her veterinarian and got the diagnosis. They did the x-ray, great, did the workup, and then said to her, yeah, bring the cat back next week, either Tuesday or Thursday, we'll be able to sedate the cat to relieve the obstruction. Wait a minute, you're going to wait a week to relieve an obstruction on a vomiting cat that has an incredible obstruction? That's malpractice. And if you don't have time to do it, you better find somebody who does have time to do it. And guess what? It's like the least fun thing in the world. It's called obstipation. An obstipated cat is every veterinarian's nightmare, I think. The chances of the bowel rupturing are pretty high. It is a smelly job. It is a long job. It is no fun because generally, by the time the pet owner realizes that the cat is not passing stool and the cat has quit eating, the cat is vomiting, these are very, very sick cats usually by the time they're presented. And they're generally very dehydrated, and then if they don't eat for 3 days, they can go into fatty liver syndrome and liver failure. So it's just a whole cascade of events that can occur with these kitties, and you don't have the option of waiting 5 to 7 days to have time to unclog the kitty cat. So the best advice that anyone gave was find another veterinarian, find an emergency service, find anybody anywhere to get this cat unclogged. That was good advice. Now let's talk about all of the bad advice that was given. Oh, give him some pumpkin. I'm sorry, the clog is this big and he's not eating, he's vomiting. Putting something else in the top when there's a cork at the other end and it can't get out isn't going to work. I mean, for a little bit of constipation, a little bit of hard stool, pumpkin's a good option. Not when they're that clogged. But the worst things that I saw were give the cat a flea enema. No. Flea enemas are sodium phosphate. Human enemas, a lot of them, are sodium phosphate. That is a death sentence for a cat. It causes their sodium levels to get very high, causes their phosphorus levels to get very high, and causes their calcium levels to crash. And so now we've taken a cat who was constipated and added on a deadly chemical for the cat. So this is why I had to jump in. I saw this go by. I see all kinds of crazy things go by on Facebook feeds, and the only reason I was looking at it was because we drove a bunch this weekend to go get hay. We had to go an hour and a half each way, so Hugh was driving and I was scrolling. So I saw it and I couldn't stay quiet because so many people posted that I was like, oh my gosh, people don't know that this is a problem. This is a huge problem, folks. And I understand that the average person looking at that x-ray couldn't understand how bad the clog was in this cat. This was a serious clog. So then somebody said, oh, well, tell your friend to get a glove and some Vaseline and to, stick their finger up there and start trying to remove some of the stool. Okay, so now we've got someone who knows nothing about cat anatomy. First of all, I would be shocked if the cat would allow that unless the cat is moribund, which, then it's too late anyway. But the chances of that bowel rupturing with somebody not knowing what they're doing, playing with it, really bad advice. Really bad advice. Somebody said, and this is actually not horrible advice, to try the little glycerin suppositories that you use for infants. Okay, that's not going to hurt the animal at least. However, this clog was so bad that is not going to solve the problem. These clogs, basically the stool gets so hard and dry in there, and literally it's this big around, there's no way that's going to come out the little tiny poop chute of the cat. The only way to break these down is to sedate the animal, get them under some pretty good anesthesia, use a very soft, flexible tube, a red rubber tube, pass it up past the clog, get a little bit of warm water in there, maybe with a little bit of mineral oil, a little bit of stool softener, and basically massage from the outside to try to break that down and get it to pass little bit by little bit by little bit. And sometimes it takes multiple days of doing that to get this stool broken down because you don't want the bowel to rupture while you're working on this process. So how do we prevent, what cats are prone to this? Well, older cats are more prone to it. From a Chinese medicine perspective, it is a yin and qi deficiency of the large intestine. So that is metal personality. It's a metal problem. Remember, that's lung and large intestine, and it's a dryness issue. So particularly cats that are fed dried kibble only, and they're fed that for the course of their lifetime, they get yin deficient. They are moisture deficient. And then as they age, they get more qi deficient, and we can get something called megacolon, which basically is their colon, their large intestine gets so stretched out, the nerves that innervate it and make it contract and pass things through don't work as well anymore. The stool sits in there too long, and so the bowel does what it's supposed to do at that stage, which is absorb moisture. So we've got this fecal ball that is getting drier and harder and bigger. And then we keep trying to shove things down the front end of the cat, and it just has nowhere to go. So in order to treat these cats, we need to give a lot of fluids, and we need to get things softened up, and we need to get things moving. We have great Chinese herbs. Once we diagnose a cat with this problem, there are great Chinese herbs that can be used for it. Acupuncture is very helpful, but diet is huge for these guys. They, again, species appropriate, high moisture diet. We need moisture. And some of these cats end up having to take stool softeners on a regular basis so that the stool doesn't get so impacted in there. If they're passing a softer stool all the time, then we're not going to get that impaction in there. I would say that in clinical practice, 95% of these cases that I saw, we solved with diet and herbs, a lot of them just with diet alone. They need a good fiber source, but if you're, and that's where the pumpkin can come into play, and most cats do like pumpkin. You can add psyllium. The problem is if we don't change the moisture and we don't change the energetics of the large bowel so that it can push things through, adding more fiber, if you're feeding dry food, you're contributing even more to the problem. So it really is a moisture problem and an energetics problem. So if you see people giving that kind of bad advice on social media, please jump in, Please prevent someone from killing their cat by rupturing its bowel or giving a fleet enema. They should never be given to our pets. So, all right, let me see. There's probably some questions down here. I'll see if I can get to any of them. Yeah, and then for raw feeders, bone content is going to be really important as well. If a lot of times when we see too much bone in the food, so sometimes, you know, the bone content might be 20%, and that can be too much. Even 10% can be too much for some animals. So Gwen says, I've noticed there seem to be two camps, some that think cats and dogs need fiber sources in their main diet, and those that don't. No, they do, because even if we're feeding a prey model diet, we're going to be feeding some feathers, some hair, some stomach contents. We're going to be feeding some fiber. They absolutely need fiber. And when we get our microbiome reports back, very commonly, when the microbiome is out of whack, it's because they need more fiber. Some of them need more protein, some of them need more fiber, but the fiber is the prebiotic for those good bacteria in the gut, so we absolutely need that. Okay, always add water to the raw. Holistic vet said the food is such good quality they absorb the food with less debris to pass. That is true. Yeah, absolutely. Is this condition common in renal failure cats? It can be more common because those cats tend to be dehydrated. The kidney failure cats are kind of always in a bit of a state of dehydration. That's why sub-Q fluids a couple times a week can be really beneficial for those kitties. And I think we tend to start those too late. I think if we started them earlier with those cats, we would extend their time before they get more advanced stages of renal failure. Used to add water to your old cat to his canned food, and he did great. Yeah, we absolutely need this. Okay. Your raw has no bone at all. Well, then, as long as you're adding a calcium source. If you reduce the bone, should you add a calcium source? That's going to depend on the food that you're feeding. So, alrighty. I mean, the cocoa therapy, yeah, Gwen put it on there, their Hairball Plus, which basically is just dried small pieces of the coconut. Great source of fiber, great source of fiber. And then we have the pumpkin as well. So the vet you worked for used soapy water. Yeah, we used DSS, which is docusate sodium, which basically is a stool softener. Oh geez, your husband is a dentist, actually takes our Pitty with him to work. They found a kitten and rescued it like 6 weeks old. She took it to the vet, who said it was okay to feed it kibble. Okay, yeah, well, that's what most of them are going to say, unfortunately. Particularly little kitten that age, they have a hard time getting kibble down even. Their teeth are pretty tiny. So anyway, if you see bad advice like that, please speak up. I tend to not interfere with other people's social media pages, but that was one of those where, God forbid, that person who was asking the question would have actually told her friend to give a fleet enema to that cat. That cat was so obstructed that the owner putting anything up the back end of that cat would have been a bad idea. But the fact that the veterinarian wasn't willing to jump on it right away, that was disturbing as well. Bummer. All right, everybody have a great day. I got a ton of work to do.